more than 50,000 Indians contact this coronavirus, new coronavirus or SARS-CoV-2 every day since June to October 2020. But our responses are different, isn't it? Most of us don't even realize that we have some sort of a virus inside us. We don't have any problem. Some struggle a little bit, maybe even go to hospital. A few of us, in fact, die. Why there is so much variation among us? It's not just immunity. There are actually 5 different types of aspects that I can consider, and I want to talk about them today. The first aspect is when we get an infection, it matters if we had that infection earlier also. That means if we had a prior exposure to the same virus or similar virus, our body might be able to fight better. See, normally when we get an infection, we might get a fever or cold-like symptoms for a few days and we recover. When that happens, next time, if the same virus comes, our body is prepared better and it actually can fight so well that we don't even realize that there is an issue. So prior exposure, what type of virus, and when was that? All these things matter in terms of what is our response. The second aspect is the type of disorders. This is very well known. What type of disorder we have can influence what type of certain proteins are there in our body, which might be virus friendly. We have a lot of different type of proteins, but in some cells on the outside, we have got certain types of proteins which are friendly to the virus proteins. So because of these interactions, the virus gets inside our cells. And that is when the viruses multiply and grow more in number. So in some people who have more such proteins, the viruses grow faster and they win the initial race. Our immune cells will have to wait for some time, they struggle, and the body gets damaged more in the process. So the type of comorbidities we have matter. Like that means people who have like the type 2 diabetes, obesity, or cancer or heart related problems, high blood pressure, etc. All of them have to be extra cautious. They're vulnerable, and people around them have to be also extra cautious because we don't want to spread the disease. We will usually know those who are around us in our family, but if it is outside the family also, whenever we see any senior citizen, it is better to be a little bit careful, okay, because that's how we actually reduce the death rate in India. General body nature. We're all not the same. We know that physically and behavior wise, we are different. We think differently, but the body's physiology also is not exactly same among us. Some of us will take a long time to heal, for example, for internal body damages particularly, it is important. So thus, especially in the severe cases of COVID-19, in the late stages, when the body is severely damaged, how fast we recover, etc., will depend on our body's nature. So general aspects like that also matter. In fact, blood groups might also matter. There is one recent report, because it's very recent, I'm showing, obviously, whatever I'm telling is because of the effort of a lot of scientists. Fourth aspect is the immunity, where everybody is aware of that, and there is a lot of information about the immunity that is spreading around, but sometimes not correct information. See, the vitamins, the minerals, some of these so-called vitamin boosters, concoctions, turmeric, etc. may help. But we should remember 2 things. Scientific evidence, scientific proof that any of those things will actually cure the disease or prevent the disease is not there. There is no proof. In fact, there is proof that if we take in excess, they can be toxic. Vitamin D, zinc can be easily toxic to our body if we take in excess. So it doesn't help normally to take more. They are supposed to be medicine-like, so we should take small amount of them for a limited duration on the advice of doctors. So if we are nervous about something, maybe I take 500 milligram of vitamin C or 500 IU of vitamin D for a few days before I consult the doctor. That is okay. But taking a lot of it for a long time is definitely not advisable. The final thing, which is most important, is virus load in the beginning stages. Okay, so how much virus gets in is important. If a few viruses get in, let's say in the nose, one virus gets in, or we prevent completely, that's the best thing. We can do that by wearing mask correctly, and washing hands thoroughly and frequently, particularly before touching our face, and of course keeping distance from people in public. If we do all these things, maybe viruses wouldn't get in. But if we are careless at one moment or in over a period of 1 hour, unfortunately, sometimes a lot of viruses get in. And now that's when we are in trouble, because viruses are going to win the initial race definitely, and the body will be in trouble. So it is prevention that matters. Prevention is better than cure in these aspects. So we are trying to bring in this type of awareness to public, and so that more people will be more aware, and do not take these preventive measures lightly, because no matter what immunity and other factors come, the most important thing which we can easily do is prevention by following the simple procedures. And that's why people keep stressing about that. In fact, there is an evidence that most Indians are good in following those rules. This September 30 article that came out in Science magazine showed, it's a very nice study actually. I like this a lot, because it's a study of about 6 lakh Indians in Tamil Nadu and Andhra Pradesh. They selected about 86,000 patients, meaning not patients, those who were positive for the disease. So they took those people and those who were in contact with them, a huge group. A study was done by a set of scientists in India and USA. And what they found is 70% of the people will never spread the virus, or most of them do not spread the virus to anybody else. Most probably they don't. But the 30% people seem to be spreading a lot. And many of them are kids, some of them are seniors who spread within the same age group. But in general, those are the ones who are majorly contributing. So if we can spread awareness, I'm doing my humble bit. I'm sure you can also tell to others, and maybe even share this video, click a like button. Please note that about 19,000 only are getting positive among Indians. And of those who are positive, 80% are asymptomatic. But still 1 or 2 in 1,000 die, and that is basically resulting in 500 to 1,000 deaths per day across several months now. We can still do better. Please do share your opinions. There is an email at the bottom, s3kannada@gmail.com. We would like to do our bit. We would like to bring scientific correct information in simple language. Okay, so just to summarize now, thanks for your time. But before I move out, I would like to summarize the points that I mentioned so far. What matters for the variation is the prior infection, if you have or not, if you have other disorders or not, if general body nature influences in different ways, and immunity, of course. But too much is too bad about the preventive measures we think are important, so we should be careful. Entry load of the virus is also important, and that in fact is the most important thing. That's where I was saying prevention is better than cure. So like this, we would like to continue bringing the gist of research findings to you in simple language. And this is me, Kshitish, who is a faculty scientist in IBAB. I'm also a founder of Shodhaka Life Sciences and BData, where Mangala has been helping a lot in making this type of videos. Thank you very much.